So we'll have a little talk about another really common problem that happens to a lot of us over a period of time. Now that's ulceration. Now normally ulceration, it'll occur and will pass in around about 10 to 14 days. And from start to finish, that's about the course it will take. Sometimes it can go on a little bit longer, and it's important to remember that if you've got an ulcerated patch that persists for more than 2 weeks, you get it looked at. Now you can get that looked at by either your dentist or your GP, your doctor, but it's important to get it looked at. Yet sometimes these things cannot be an innocuous thing. They can go on to be something more significant. That doesn't mean nasty, sinister, but it can sometimes be indicative of another problem, and it's important to get these things checked out. But let's just deal with simple aphthous ulceration. So a small ulcer typically measures between 5 mils and can get up to 1 centimetre. That's called major aphthous ulceration. They're less common. These things typically are sort of 1/2 centimetre-ish. You can get 2 or 3, and sometimes they can join together and they can be really, really sore. But again, that's what it is. It's a minor aphthous ulcer. Now, most common causes for that are trauma. So you've bashed yourself with a crisp or a overly hot cup of tea or something like that. Other common causes are stress, and certainly at the moment there's plenty of that going around for all of us. The other things that can cause that are dietary deficiencies. So we can get dietary deficiencies with iron, folic acid, vitamin B complexes, so any of the 2, 4, 6 and 12 vitamins. And again, important not to worry about that too much at the moment, but if it's a persistent thing, it recurs and recurs and recurs month after month after month, then it might well be again worth going to get that checked out, again with dentist or with your GP. What can we do? Well, the long and short of it is try and manage the symptoms that we've got. So again, try and avoid spicy foods, again other things with sharp edges that might traumatize and bash that area some more. We want to try and avoid damaging an already damaged area. You can use things like Bonjela, or there's another product called Igloo, which hang around for a little while, so they numb the area up a little bit and provide a little bit of respite from the symptoms that you get from it. Again, if there is a cause of it, try and look for the cause. So I can't remember doing anything like that, but maybe there's a rough or broken tooth. Again, we've talked about that in one of the other videos. Have a little look at that as to how you might go about improving the situation there. Important thing is not to worry about that too much. Try and manage the symptoms as much as you can, but if it persists for 2 weeks or more and doesn't seem to be getting any better, get it looked at. Really, really important. Get your doctor, get your dentist to take a peek at that, and hopefully then come up with a reason why you've got what you've got, and if not, then you can get it diagnosed further. Thanks.